You've reached an age where every twinge seems to carry a warning, and if you're living with prostate issues, even the thought of self-pleasure can feel risky. I'm Dr. Henry Carter, a urologist with over 2 decades of experience helping men over 60 reclaim their confidence and comfort. Today I'm going to guide you through 5 safe doctor-approved techniques that let you enjoy solo time without aggravating your prostate. First, imagine a simple, pain-free experience where you don't have to worry about irritation or discomfort. Picture yourself in a calm, private moment, fully in tune with your body's signals. In the next few minutes, you'll learn how to prepare, position, and pace yourself so that pleasure and prostate health go hand in hand. No more anxious starts or painful stops, just straightforward, expert-backed advice that lets you relax into the moment. We'll begin by easing into the routine with gentle warm-up strokes, move on to choosing the perfect lubricant and maintaining proper hydration, explore the best body angles for comfort, incorporate simple pelvic floor exercises, and wrap up with tips on mindful frequency. By the end of this video, you'll have a clear step-by-step roadmap to safe solo play, because intimacy shouldn't stop at prostate concerns. It should evolve around them. Let's get started. Why prostate health matters for solo play. Before we dive into techniques, let's understand why your prostate deserves extra care during self-pleasure. The prostate is a walnut-sized gland nestled just below your bladder and surrounding the urethra. Its primary role is to produce fluid that nourishes and transports sperm. But with age and conditions like benign prostatic hyperplasia or prostatitis, that gland can become inflamed, tender, or enlarged. When you stimulate the penis, especially with firm pressure or rapid motions, the prostate can feel jostled. That jostling may trigger discomfort, burning sensations during or after release, and even urinary urgency. Left unchecked, rough handling can exacerbate inflammation, prolong recovery, and in some cases lead to infection. But here's the good news: you don't have to give up self-pleasure to protect your prostate. By tuning into gentle stimulation, respecting sensitive tissue, and pacing yourself, you can enjoy intimacy without inviting pain. Think of it as upgrading from bumper car collisions to a leisurely drive. You're still on the same road, but with smoother turns and softer braking. In this section, you'll learn how simple adjustments, starting with awareness of pressure, choice of products, and mindful pacing, lay the foundation for the 5 safe techniques we'll cover next. Remember, every man's body is unique. What feels soothing when you're healthy might feel aggravating when inflammation is present. That's why starting slow and listening to subtle cues like slight twinges or changes in sensation is crucial. So as you follow along today, I want you to adopt a mindset of exploration rather than performance. Ask yourself, how does this feel? Am I applying too much force? Is there discomfort I can ease off? By framing self-care as a discovery process, you'll build confidence in knowing your limits and the freedom to enjoy solo moments without second-guessing yourself. Next, we'll walk through the first practical tip: gentle warm-up strokes that prime both your nerves and your prostate for safe, enjoyable stimulation. Let's ease into it. Tip number 1, start with gentle warm-up strokes. Before you ramp up intensity, take at least 1 to 2 minutes to acquaint your body with gentle, exploratory touch. Begin by situating yourself comfortably, whether seated on the edge of the bed or leaning against a stack of pillows. With clean, well-lubricated hands, place your fingers lightly along the shaft. Allow your grip to be almost feather-light, barely brushing the skin. Inhale slowly and exhale, tuning in to the subtle sensations. Feel the warmth of your hand and the slight stretch as you trace a soft, upward stroke from base to tip. Each pass should feel effortless, no tugging, no sliding friction, just smooth gliding. As you continue, gradually let your strokes widen in scope, moving from the center of the shaft toward the sides. Notice any areas that feel particularly sensitive. If you encounter a tender spot, pause for a moment and breathe into that sensation, allowing any tightness to ease. Then resume, perhaps avoiding that exact spot or reducing pressure even further. By warming up in this way, you're sending a clear message to both your nervous system and your prostate. We're in no rush. Let's awaken gently. This light contact increases local blood flow, so your tissues become more resilient when you move into deeper stimulation. After a minute or 2 of steady, gentle passes, you may feel natural lubrication increase. That's your body's way of saying it's ready for the next phase, more intentional but still mindful movement. Remember, at no point should you feel sharp tugs or burning. If you do, dial back immediately. This warm-up isn't just physical preparation, it's a mental cue to slow down and listen to your body's feedback. In these early strokes, you're building trust between sensation and control. You're learning where your comfort zone begins and ends, and in doing so, you guard against surprises that could inflame sensitive prostate tissue. Once you feel a gentle buildup of warmth and arousal without pain or undue pressure, you're primed to move on to the next tip, where we'll select the ideal lubricants and discuss hydration strategies to maintain comfort and protect delicate areas. But take your time here. A solid warm-up lays the groundwork for an entirely smoother, safer experience. Tip number 2, choose the right lubricant and stay hydrated. Now that you've warmed up your nerves and tissues, it's time to ensure every glide is as comfortable as possible. Start by selecting a high-quality water-based lubricant, nothing oil or silicone-based, which can trap bacteria and irritate sensitive areas. Look for products labeled hypoallergenic and free of fragrances, dyes, or glycerin, all common culprits for itching or burning. Before you begin, apply a generous dollop about a fingertip's worth directly onto your palm. Rub your hands together to warm it, then spread a thin layer along the shaft and around the glands. Notice how the added slipperiness almost erases any drag, allowing your strokes to feel smooth and uninterrupted. If the lube begins to feel tacky, simply reapply rather than increase pressure. Hydration is your silent ally in prostate health. Drinking water throughout the day keeps your tissues supple and less prone to micro-tears. Aim for at least 8 8-ounce glasses daily more if you're active or live in a warm climate. Well-hydrated prostate tissue recovers more quickly from any mild irritation and reduces the risk of post-session soreness or urinary discomfort. During your session, keep a glass of water nearby. Take small sips between strokes, using deep exhales to relax pelvic muscles. Proper hydration also supports natural lubrication inside the urethra, diminishing friction if any fluid reaches your tip. If you notice any stickiness or dryness, pause for a sip and gently massage the area until moisture returns. Remember, more lubricant is never a bad thing. Unlike too rough pressure, excess gel cannot harm your prostate. And by consciously hydrating before, during, and after self-pleasure, you're reinforcing your body's ability to heal and maintain comfort. With the perfect slickness and well-hydrated tissues, you're now ready to explore positions that optimize prostate safety. In the next segment, we'll break down 3 body angles: back-lying, side-lying, and seated, that minimize unwanted pressure on your prostate while maximizing pleasure. Let's find your ideal setup. Tip number 3, optimal positioning for comfort. Let's explore how your body's angle and support can make all the difference. First, lie on your back with knees bent and feet flat on the mattress. This position gently tilts your pelvis upward, reducing direct pressure on the prostate. Place a firm pillow under your lower back to elevate your hips just enough so you feel a slight stretch in your groin. As you stroke, notice how the shape of your pelvis channels sensation along the shaft without forcing the prostate into an awkward angle. Next, try side lying on the edge of the bed. Draw your top knee toward your chest while keeping the bottom leg extended. This fetal posture slightly twists the pubic bone, creating a natural buffer between your shaft and prostate. Use your free hand to steady your arm or brace against the mattress. In this position, you may discover certain strokes feel more focused, softer at the base, firmer near the tip without any jarring movement. Finally, experiment with a seated posture. Sit halfway off the chair, feet planted shoulder-width apart. Lean forward, resting your forearms on your thighs. The forward tilt of your torso shifts the pelvis back, increasing the space behind the prostate. Spread lubricant generously and use long, steady strokes, paying attention to how each glide feels differently when gravity is at play. Throughout these positions, keep a small pillow or rolled towel handy to adjust under your hips, lower back, or even between your thighs. Tiny changes in elevation can transform a good stroke into a great one that glides over the prostate rather than pressing directly into it. As you switch from back to side to seated, pause between each position. Breathe deeply, notice any areas of mild tension, and adjust your support until everything feels balanced. If you feel a pinch or tug, back off and reposition until only smooth, pain-free motion remains. By finding the right angle, you're respecting the prostate's sensitivity and unlocking new pathways for pleasure. The best position is the one where you feel safe in control and free from unwanted pressure, whether you choose to stay in one posture or blend them fluidly throughout your session. Next, we'll integrate simple pelvic floor exercises to prime blood flow and support your prostate during solo play. Tip number 4, incorporate pelvic floor warm-ups. Before you return to stroking, spend a minute on quick pelvic floor exercises, often called Kegels and reverse Kegels, to boost blood flow, release tension, and support prostate health. This isn't about turning your session into a workout. It's about priming the muscles that cradle your prostate. Start seated or lying on your back with knees bent. Take a deep inhale, then as you exhale, gently contract the muscles you'd use to stop urination. Hold for 3 seconds, then release fully. That's 1 Kegel. Repeat twice more, focusing on smooth, deliberate squeezes without tightening your abdomen or buttocks. Next, try a reverse Kegel inhale, and as you do, gently bear down as though you're starting to urinate, but stop yourself. Hold that soft push for 3 seconds, then relax. This movement encourages blood to flow into the pelvic floor, creating a fuller, more responsive region around your prostate. Complete 2 reverse Kegels. Finally, perform 1 flutter set, rapidly contract, and release your pelvic floor muscles for 5 quick reps. Think of them as tiny taps, fast, light contractions that wake up your pelvic nerves. Throughout each exercise, maintain steady breathing. Inhale through the nose, exhale through the mouth, and let your abdomen rise and fall naturally. Avoid gripping your glutes or quads. The focus is purely on the pelvic floor. Once you finish, lie back or sit comfortably. Notice the gentle warmth and slight fullness in your pelvic region. That's the blood flow we want. Return your hand to the lubricant slick shaft and continue with your strokes. You'll likely feel enhanced sensitivity and a smoother glide because those muscles are now relaxed and ready to support the prostate rather than resist it. By weaving these micro exercises into your routine, you safeguard delicate tissue, enable better control over sensation, and reduce the risk of sudden discomfort. Plus, over time, stronger pelvic floor muscles can improve erectile function and urinary control. 2 added bonuses that benefit overall prostate health. Now that your pelvic floor is primed, let's move into our 5th and final core tip: mastering mindful frequency and moderation to protect your prostate between sessions. Tip number 5, mindful frequency and moderation. Knowing when to pause is just as important as knowing how to play. While it may be tempting to maintain peak frequency, especially when technique feels good, overdoing it can lead to lingering soreness, heightened inflammation, and urinary irritation. Aim for no more than once per day on average, with rest days built in based on how your prostate feels. For example, if you experience any mild ache or urinary urgency, the next morning consider taking a 24 to 48-hour break before resuming. Use a simple symptom journal note, the date, duration of session, and any post-session sensations, e.g. slight burning, no discomfort, mild fullness. Over time, you'll spot your personal threshold. During active days, listen to cues in the moment. If you notice stiffness developing mid-session, dial back pressure or switch to gentler warm-up strokes. If twinges persist, end the session early rather than push through. Think of each session as a negotiation between pleasure and comfort. You want to leave the table satisfied, not sore. For men on medications that affect prostate size or urinary flow, like alpha blockers, discuss recommended solo frequency with your physician. There may be specific guidelines tailored to your treatment. And if you ever experience sharp pain, blood in urine, or fever, pause all activity and contact your healthcare provider immediately. By practicing moderation, you're giving your prostate time to recover, reducing cumulative trauma, and ensuring each session remains a positive experience. Remember, consistency over time with attention to both enjoyment and safety yields the best long-term results for both pleasure and prostate health. Bonus tip: use gentle toys, safely optional. If you're curious about experimenting beyond just hands, toys can add variety so long as you choose and use them with prostate sensitivity in mind. First, select a toy made of medical-grade silicone with a smooth, rounded tip and no ridges or seams. Avoid hard plastics or glass that transfer shock to the prostate. Before use, sterilize the toy according to the manufacturer's instructions, usually by washing with mild fragrance-free soap and warm water. Inspect it carefully, no cracks, no rough edges. Apply a generous layer of your water-based lubricant along the shaft and head, then reapply lubricant directly onto your urethral opening if you're planning any light internal stimulation. When you're ready, insert the toy slowly, just an inch or two, while breathing deeply to relax your pelvic floor. Pause if you feel any resistance or sharp pressure. Think gentle exploration, not deep massage. Once the toy is in place, you can experiment with micro movements, tiny in and out pulses, or slight circular rotations. Keep the thrust depth minimal, never beyond the point where you begin to feel fullness in your rectum or a direct jolt to the prostate. Limit toy sessions to shorter durations, 5 to 10 minutes, to prevent overstimulation. After removal, clean the toy again and let it air dry. Monitor your body over the next 24 hours. Any unexpected soreness or urinary discomfort means you went too far too fast. Above all, consult your urologist before your first toy-assisted session, especially if you have implants, strictures, or significant inflammation. With the right choice and careful technique, toys can be a safe, pleasurable addition to your routine, always with prostate health as the priority. Common myths and FAQs. Now let's clear up some of the most persistent myths and answer your top questions about solo play with prostate concerns. Myth: daily masturbation worsens benign prostatic hyperplasia, BPH. Truth: there's no solid evidence that moderate daily self-stimulation makes BPH worse. In fact, gentle, regular movement can promote circulation and reduce congestion around the gland. What matters is how you do it: slow, mindful strokes with proper lubrication, not aggressive pounding. FAQ: can I use alcohol-based gels or soaps instead of lube? Answer: absolutely not. Alcohol dries and irritates delicate skin, increasing friction and microscopic tears. Always choose a fragrance-free, water-based lubricant labeled hypoallergenic. Myth: prostate massage during masturbation is too risky. Truth: light external prostate stimulation, like very gentle perineal pressure, can be safe when done correctly. Internal prostate massage carries higher risk and should only be performed under medical supervision. FAQ: is it normal to feel slight discomfort the first few times? Answer: mild awareness in the prostate area can occur when you're learning new techniques, but sharp pain is a red flag. If you feel anything beyond a gentle tingle or fullness, stop and reassess your pressure position or lubrication. Myth: less lubrication equals better grip and more pleasure. Truth: lack of sufficient lubrication leads to increased friction, which irritates the urethra and prostate. More lube means smoother motion, less risk of injury, and ultimately more sustained pleasure. FAQ: how long should I wait after a flare-up before resuming? Answer: after any episode of significant discomfort, swelling, or urinary urgency, give yourself at least 48 to 72 hours of rest, combined with soothing sitz baths and hydration. Only resume when you can perform gentle warm-ups without pain. By busting these myths and providing clear doctor-backed answers, you'll navigate solo pleasure with confidence, knowing you're protecting your prostate every step of the way. Expert advice from Dr. Henry Carter. Gentlemen, I'm Dr. Henry Carter, and I want to leave you with a few final pointers to ensure your solo sessions remain both safe and satisfying. First, remember that prostate-friendly self-pleasure is all about respect. Respect for your body's limits, its signals, and its natural pace. There's no competition here, only a journey toward understanding what works best for you. Always prioritize warm-up strokes. Those initial featherlight passes aren't optional, they're essential. They prepare your nerves, prime blood flow, and create the comfortable environment your prostate needs to stay healthy. Skip them and you risk surprise discomfort that can linger for days. Next, don't skimp on lubrication or hydration. A well-lubed shaft with water-based gel transforms every glide into an effortless caress. And staying hydrated isn't just good for your overall health. It directly impacts how quickly your tissues recover. Aim for consistent water intake throughout the day and keep that glass at arm's reach during your session. Positioning matters more than most men realize. Whether you choose to lie on your back, curl up on your side, or sit forward in a chair, small adjustments with pillows or towels can mean the difference between smooth pleasure and unwelcome pressure. Treat each position like an experiment. Breathe, feel, and fine-tune until you discover your personal sweet spot. Incorporating pelvic floor exercises is a game changer. Those Kegels, reverse Kegels, and flutter taps don't just support prostate health, they heighten sensation and give you better control over your experience. Spend just 30 seconds on them before each session, and you'll notice the difference immediately. Finally, listen to your body's rhythm. Masturbation is not a race. Moderation paired with a simple symptom journal lets you find your own ideal frequency without crossing into soreness or inflammation. If you ever feel sharp pain, take a break, seek medical advice, and adjust accordingly. By combining these techniques, slow warm-ups, quality lubrication, optimal positioning, pelvic floor prep, and mindful frequency, you're not only safeguarding your prostate, but elevating your solo pleasure to a new level. Stay curious, stay patient, and always put your comfort first. Thank you for watching. If you found this helpful, please like, subscribe, and share your questions or experiences in the comments below. Here's to safe, satisfying self-care, no matter your age. Conclusion. Let's recap the 5 key ways to masturbate safely with prostate issues. Warm-up strokes: spend 1 to 2 minutes on feather-light touches to prime your nerves and prostate. Right lubricant and hydration. Use hypoallergenic water-based lube and sip water throughout to keep tissues supple. Optimal positioning: experiment with back-lying, side-lying, or seated angles, using pillows for support to minimize direct prostate pressure. Pelvic floor warm-ups. Do a few Kegels, reverse Kegels, and flutter taps before you start to boost blood flow and control. Mindful frequency: limit sessions to once a day on average, rest when necessary, and track symptoms to find your personal rhythm. Optional bonus. Gentle toy use can add variety. Just choose smooth medical-grade silicone, insert slowly, and limit duration. By weaving these expert-backed techniques into your routine, you'll protect your prostate, enhance sensitivity, and enjoy worry-free solo pleasure. If you have questions or personal experiences, drop them in the comments below. Our community learns best when we share. If this guide helped you, please like, subscribe, and hit the notification bell so you don't miss future tips on men's health and intimacy. For more resources, check the description box there. You'll find links to reputable urology sites and suggested reading. Stay safe, stay informed, and here's to embracing confidence at any age.